I am Dr. Sumit Agarwal. I am a physician diabetologist practicing in Kothur, Pune. Today I will be talking about hypertension. Hypertension is defined as blood pressures more than 130 systolic and diastolic of more than 80 millimeters of mercury. What is hypertension? Hypertension actually is the pressure exerted by the flowing blood on the blood vessels. It is very basic, very simple. The definition of hypertension does not change with age. It is same for all age groups. So a young patient with 140/90 is also hypertensive, and a patient who is 60 years old with BP of 140/90 is also hypertensive. So it does not change with age. Causes of hypertension are, most important cause is the family history. Genetics plays a big role in hypertension. If you have a family history of hypertension, you are bound to get hypertension. You might get hypertensive in future. Other causes are sedentary lifestyle, obesity, excessive tobacco, alcohol, smoking, excess salt intake. These are other causes of hypertension. There is also a group called secondary hypertension, which has got a lot of systemic disorders which can cause hypertension, but that I won't be discussing in detail. Around 1/3 of the adults are hypertensive. The risk factors for hypertension again is genetics, sedentary lifestyle, obesity, tobacco, alcohol, excess salt intake. These are the risk factors for salt intake. If you can cut down on these risk factors, maybe your chances of becoming a hypertensive are less in future. Treatment is actually more of lifestyle first, and then comes the pharmacology, the drugs. Pharmacology is the drugs. Once your BP is under control with maybe lifestyle or pharmacological drugs, your treatment should not be stopped. That is a very common mistake what people tend to do. Once the BP is normal, they stop the medicines, which is absolutely wrong. The blood pressure medicine will continue for life. Your BP is under control because you are taking the medicines. It is not your BP. Hypertension is a disease which cannot be cured. It can only be kept under control. So the common question the layman asks to a doctor, now my BP is under control and should I stop the medicine, which is absolutely wrong. Symptomatology, generally hypertension does not have any symptoms. It hardly has any symptoms. Even a patient with 170, 110 may be just walking, talking with no symptoms. But patients who have symptoms like easy fatigability, excessive sweating, irregular heartbeats, some chest discomfort, breathlessness on walking, definitely need to be screened for to see if he has hypertension. A blood pressure of more than 180/120, that is hypertensive crisis, irrespective of symptoms, needs to be hospitalized. It is an hypertensive crisis and they require immediate treatment. If the blood pressure is not kept under control, there are going to be complications, and the whole reason of treating hypertension or screening hypertension is to avoid complications. So what are the complications? Complications like heart attacks, complications like paralysis attacks, complications like kidney failures. These are the main bulk of people. These are the main causes for mortality or morbidity in patients with hypertension. So if your BP is kept under control, these three complications will be very, very less. Treatment, or most important part, as I mentioned previously, lifestyle modification. That is the most important part of hypertensive treatment. First of all, you should exercise. You should walk for at least 45 to 50 minutes per day. Walking, jogging, cycling, swimming, anything will do. Any kind of aerobic exercise is absolutely mandatory. Cut down on your salt intake, make it less than 4.5 to 5 grams per day. Reduce smoking, alcohol, reduce tobacco. Increase the intake of potassium rich food like coconut water, fruits. That is definitely going to help you in reducing the blood pressure. And even with these modifications, if there is no reduction or there is no significant reduction in weight, maybe you require antihypertensive treatment or drugs. So the take home message about hypertension is a disorder. It's a lifelong disorder which needs to be treated aggressively to avoid complications related to heart, brain and kidney. Thank you.